Okay, and I'm hoping that it is a video recording and not a voice recording. Let me unshare it for a brief second. And actually, yeah, let me just stop share for a second and start recording here. Yeah, no, everything is good. Everything is good. It is recording. Sorry about that. Okay, so how are you folks? Everyone good? A couple of people, actually quite a few of you asked about homeopathy for first aid in the last several weeks, and I thought I would just do a short session on this and walk you through some of the remedies and also some of the reasoning behind using homeopathy for first aid. So the first rule of our life anyhow is primum non nocere, which is first do no harm. And what has happened, let me move these somewhere else. Okay, here we go. What has happened in the model of first aid and emergency medicine is we're doing anything we can to save that person, and often at a cost to their long-term health. So primum non nocere means first do no harm. And there's a specific Hippocratic principle, and that is that into whatsoever house you shall enter, it shall be for the good of the sick to the utmost of your power. You're holding yourselves far aloof from wrong, from the corruption, from the tempting of others to vice. And this was written many, many years ago. Land, you had a question? Okay. And so that's what we need to keep in mind at all times. And that's why I wanted to make a plug for soup here. There's nothing as nourishing and as medicinal as homemade soup. And I'm hoping that you're making soup every day for the rest of the week or the next couple of days, just from leftovers, throw in a few bones, a little bit of meat, and just keep that thing going, because it is so much more nutritious than anything you could take by way of medication. We're going to talk about hospitals and emergency rooms today. And I just wanted to show you this graph. This graph goes from 1841 all the way to 1849. And it shows the percentage of patients who died of puerperal fever in a hospital. And on the left-hand side, on the y-axis, you see 5, 10, 15, 20, 25. This is not the number of patients that died in hospital, guys. It's the percentage of the people entering hospitals that died during these times from this fever. And so doctors didn't know about disinfecting, they didn't know about germs. They would go to the cadavers, hack them up, come upstairs to the obstetrics ward and pull babies out, and these mothers would die of the puerperal fever, other patients would die. And so hospitals historically have been a place of death. People who could afford not to go to hospitals never went to hospitals. And then the chlorine hand wash was invented. Do you see 1847 here? That's when the chlorine hand wash got invented, and that's when the death rate went down. It went down, and then when the antibiotics were started, it went down substantially, but not for long, And we're going to talk about that. We're going to talk about something called iatrogenic deaths, which happen in the US every single year. And these deaths are frequently coded to disease, or they're not coded at all. But roughly, by various measures, about 800,000 to 1 million people every year die from specific hospital and doctor related or emergency related deaths that happen in a hospital setting. So here's some data from 2017. We had 2.8 million people die. Of these, oh wait, coronavirus has now killed about 100,000 people in the US, remember, of which About 40% are in New York, New Jersey. So you have to wonder what they did was different than the rest of the country. Anyhow, heart disease kills about 650, 700,000 people. Cancer kills about 600,000 people. Chronic lower respiratory diseases kill about 160,000 people. Accidents and injuries kill another 170,000 people. Stroke kills about 150,000. Alzheimer's, 121,000. Diabetes, another 83,000. Flu and pneumonia, 55,000. So this year we have, this was in 2017. This year we are at about 100,000 for the COVID deaths, which would be lumped under flu and pneumonia. Only a lot of the deaths are for people with comorbid conditions who would have died from heart disease, cancer, chronic lower respiratory disease, stroke, etc. So there's some confusion there. But the point here is, out of the 2.8 million people die every year, and as many as close to 1 million people die from errors. And I'll go through those. This is the stuff that I could find on data that was researched or collected in 2011. And back then they said 1 in 25 hospital patients, and this number has increased, 1 in 25 patients has at least one healthcare associated infection, at least one. About 75,000 hospital patients with healthcare associated infections die during hospitalizations. So like my next door neighbor went in with a broken rib and got the inline infection and had to be intubated, was in ICU for 2 months, that sort of thing. More than half of all these infections occurred outside of the intensive care unit. So people go in for a laparoscopic surgery. They will go in for a broken leg. They'll go in for a broken rib, and they'll come out of intensive care. The major site of infection is pneumonia. Hospitals are the place of pneumonia. Gastrointestinal illness acquired at the hospital. UTIs, urinary tract infections, have killed 93,000 people annually, and this is annually how many they kill. Primary bloodstream infections, that is sepsis of various kinds, kills about 75,000 people every year. Surgical site infections from inpatient surgery kills about 160,000 people. Other types of infections kill about 820,000 people. And that adds up to your number of about 721,800 deaths roughly in 1 year. So annual rate is about close to 750,000. And what kind of things, iatrogenic or hospital-related deaths, do people die from? One is adverse drug reaction. So you took chemo and you died. I had someone else recently who passed away from chemotoxicity. We had our Teddy, one of our group members, dying 4 days after chemo. Medical error, this is where they just make a wrong judgment call and 100,000 people get killed annually from that. Bed sores kill a lot of people. So you land in hospital, you got tubes and all in your face and body, you can't move around. You get bed sores and you die from that infection. Other infections, 88,000. Malnutrition, you know what they feed you in hospital, right? They don't feed you chicken soup. So malnutrition kills 108 of these, 1,000 of these. Outpatients die from hospital and medical errors at the rate of 200,000 per year. And unnecessary procedures, 40,000 people die annually. Surgery-related procedures, so total of about 800,000 to 900,000 people die from iatrogenic illness in hospitals, emergency rooms, and with doctors. And yet, when we get the first burn, when we get our first dog bite, when my partner got bitten, his mother took him to, hold on, Margaret's calling. Hi, Margaret.
Hi, I think we're messed up or somehow we can't get on.
You have to, my darling, you have to click on the link in the email that I sent you, and it's a different passcode.
Oh, it's not the password you gave us?
No, it's in the email that I sent to you. Just look at that.
Well, we've been doing it for the last...
Okay, hold on. Hold on, guys.
Sushma,
Yeah.
I think the issue is she needs to copy the whole link and then put it in her browser because part of it was not highlighted, so she's not able to click on the whole link.
Oh, got it. Okay. Margaret? Margaret?
And actually, Sushma, I just did it from the email and it worked perfectly.
Oh, okay.
Just
Margaret?
clicking.
Okay.
It didn't for me.
Okay, so she'll figure it out. Yeah, okay. Alrighty, back to the emergency rooms and hospitals. So we're looking at about 800 to 900,000 people dying from hospital-related errors, over-medication, medical error. They take out the right breast instead of the left breast, infection, malnourishment, and a lot of unnecessary procedures. I recently had someone who was 82 years old. He was very frail. He had some sort of cancer, but he was too frail for chemotherapy, and the doctors go into this aggressive chemotherapy for the very elderly, knowing that they're not going to survive the chemotherapy, but they get $1 million and he died. This was a close relative of mine, so I'm still very sad about that. So there's a lot of these kinds of deaths in hospitals, and if we can avoid them, that's a really, really wonderful thing. And what has happened in New York is tragic, because in the country, in the United States, we've had about 100,000 deaths, but 40,000 of those are in New York, New Jersey. 40,000 of those deaths are in New York, New Jersey, and again, related to hospitals. And the non-COVID death rate in New York has gone up 8-fold. So in the same period last year, 3/30 to 4/5, April 5th, 19, we had 69 911 calls, and of those, about 26 people died. But in this year, same period, March to April, there were 284 calls, and there were 200 deaths per day, which is an 8-fold increase. So something in the hospital system has broken down because of the COVID. So now people are dying in the hospitals from COVID. They're dying from ventilators in the hospitals from COVID. They're dying in nursing homes because Cuomo passed an order that positive patients were forced into nursing homes, which was one of the stupidest things you could have, or the biggest blunder New York could have made. And we had 5,000-10,000 people die in these nursing homes from the infected patients that were dumped into nursing homes. And hospitals have cut down non-COVID staff. So in the current environment, going to hospitals and emergency rooms is a huge, huge risk. And in the past, it was also a huge risk. So if you think that 800,000 or 900,000 people died from iatrogenic deaths in years prior, in this year, I guarantee you that number is 1.5 times to 2 times that. Okay, now I hope I've scared you enough and you can think about chicken soup as healing food. The more good food you eat, the less you're likely to be sick. The more pesticide-free food you eat, the better your health is gonna be. The sooner you'll recover from emergencies. So that's a plug for good, nourishing soup going on your stove at all times throughout this. And what does medicine have to offer then and now? In the old days, we had syphilis, we had gonorrhea, and we didn't know how to deal with these diseases. And so we used mercury. Someone just joined?
Yes.
Excellent. And who is this?
My name is Joseph Ehrman. I'm a friend of Karen's.
Oh, yes. Hello. Hi. Howdy. We just finished talking about iatrogenic deaths, and we're talking about medicine then and now. And so we use mercury for syphilis, folks, so that the mercury killed the syphilitic bacteria, the spirochetes, but then you died off mercury poisoning. We had arsenic for syphilis and psoriasis, and people died en masse from arsenic poisoning. We had bloodletting, one of our famous presidents, George Washington killed himself by bloodletting. And these are just horrific conditions under which people were treated. And if they would have lived for 6 months with the disease, they lived for, maybe a fraction of that, a month or a week with the treatment. Things have not changed much. We now have Tylenol, we've got aspirin, we've got steroids to take care of emergencies, headaches, stomach aches, vomiting, antibiotics. We've got chemo, radiation, and surgery. And our doctors under huge pressure to meet their revenue quota, to get a certain number of surgeries done, appendices removed, thyroids taken out. They have huge amounts of school debt. They want to build their pool extensions, and they have to meet these patient requirements. So they're under stress. The other thing that impairs medical treatment, especially in emergencies today, is the standard of care. You got to do what you got to do or you get sued. So regardless of whether you need antibiotics for a dog bite or not, if you go to a hospital, you're going to get them. Regardless of whether you need a tetanus shot or not, you got a bite, you got to go get it. So the standard of care is not applicable to personal health as much as it is to saving liability. So we're sort of, I'm saying this year, 1 to 1.5 million people will die from hospital doctor-related errors. And I stand by that number based upon history. Now, enough of the philosophizing and down to the brass tacks. Let's talk about aspirin and what a good homeopathic replacement for aspirin is. And folks, ask questions as we go along. I think that's a good idea. A lot of people have been advised to eat aspirin, especially if you're a heart patient, and aspirin a day keeps the doctor away. Well, let me tell you what aspirin does. It causes nausea, vomiting, and it induces bleeding that can lead to nutritional depletions, long-term use of aspirin, even baby aspirin. If you eat buffered aspirin, you're getting aluminum and other neurotoxic stuff in your belly, so it's not doing you a lot of good. Larger doses of aspirin, which is continuous aspirin eating, affects your carbohydrate metabolism. So it induces hyperglycemia, which is high blood sugar, which is diabetes, or hyperinsulinemia, which is higher insulin levels and therefore diabetes. And it also depletes your muscle glycogen levels. And what happens when your muscle glycogen levels are depleted? You feel weak. So aspirin literally makes you bleed, causes nausea, makes you have muscle weakness. It inhibits fat metabolism, lipolysis, which is breaking down fats. So people who eat aspirin frequently cannot digest fats, and fats are a very, very important nutrient. The breakdown of fats is very important to our health. Our brains are made of fat. Our hormones are made from the stuff present in our animal fats. It causes liver damage and decreased renal function. It depletes your folic acid, iron, potassium, sodium, and vitamin C absorption, and depletes those minerals and vitamins. If you take vitamin E along with an aspirin, you can have and do have excess bleeding, and that excess bleeding over time will lead to irritable bowel syndrome, colitis. It also damages your gut microbiota, and we'll talk about that a lot. But it damages the villi. Your stomach your intestines are lined with this brush border, and aspirin is very toxic to the brush border, which causes you to have a leaky gut and for your food particles to go into your bloodstream undigested. So I just decided to use aspirin as an example of the kinds of fixes we're trying to use for pain, fever, and for long-term use, and it's pretty deadly. So the result of all this is for folks on 10, 20 years of low aspirin, general malabsorption, especially iron and calcium. So this is a lot. It's an over-the-counter medicine, but it has a lot of dark sides. And then when you can't digest properly, you get acid reflux, you're assigned or you're prescribed proton pump inhibitors. Did you want to raise your hand? Anyone that was that had proton pump inhibitors administered to them? I'm going to put this chat in the center here so that people can send messages, or you can unmute if you have questions. But proton pump inhibitors are used to reduce acidity in the stomach, which is actually caused by the drug. So now you're taking two drugs to address the problems of one drug. And synthetic, so many side effects. It's a good idea if you have been advised to take aspirin for your heart to replace it with ARNICA 6X. ARNICA 6X is a beautiful homeopathic remedy, and it is a great replacement for aspirin for heart conditions.
Sushma, a brief question. It goes back a few steps, but the iatrogenic disorders that you described in the hospital, can you tell us what the source for that information is? I've never seen that, and I just wondered where you got the information.
Yes, this adverse drug reaction is by Lazaro and Su. These are researchers, and the authors are named in the right-hand corner. Medical errors is by the Institute of Medicine. They come out with these reports. Bed source is by Zakelis and Barzak. Infection, papers by Weinstein and MMWR. Malnutrition by the Nurses Coalition. You made it. Outpatients by, so the references are posted here, Land.
Got it, thank you.
And you can go to them and I'll send you separate links as well.
Good, thank you very much.
Any other questions? Welcome, Margaret.
Thank you. We finally did it.
You did it. Okay, so we're talking about medicine then, medicine now. Tylenol reduces your fever, but fever is a very healing thing. And so, the point I wanted to make was medicine has not changed much between then and now. Where we had mercury and arsenic, we have chemoradiation and surgery. Our doctors are under pressure, and because of standard of care, we're applying square pegs into round holes. We talked about aspirin and the adverse effects of aspirin. I don't think any of you are taking aspirin on a regular basis, but if you're taking it for a heart condition, please know that ARNICA 6X will do the same job without side effects. If you're taking it and you have diabetes, please know that aspirin will exacerbate your diabetes. You're better off taking an ARNICA 6X.
ARNICA 6.
And then you're prescribed proton pump inhibitors. But what do proton pump inhibitors do? There's a very good article by John Cook, I think Texas A&M University, unexpected effects of proton pump inhibitors. These are the Prilosec you get because you've taken aspirin and now you have acid indigestion. So what they do is they inhibit the activity of something called DDAH, which is a kind of an enzyme. This enzyme increases your asymmetric dimethyl arginine. You don't need to know what it is, except that that's a bad thing. And this ADMA inhibits your nitric acid synthase, which reduces your production of nitric oxide. So nitric oxide is required to dilate your blood vessels. And proton pump inhibitors prevent the dilation of your blood vessels, cause vascular inflammation, thrombosis, and you see a lot of heart attacks from Prilosec and other proton pump inhibitors.
You just turned me off when you turned yours.
And so there are a lot of risks in taking a lot of these drugs. For a person who just had a heart attack, for a person who had bypass surgery, and a person who has the 10 heart medications given to them by our current medical establishment. Joette is a great homeopath. She writes for the Weston A. Price Journal. She gave her dad, who had had bypasses, several heart attacks, was in danger of stroking out, Arnica montana 3 or 6X twice daily. Magnesium phosphoricum 6X twice daily. Crataegus tincture, 5 drops twice daily. Sea kale cornutum 30 twice daily. Digitalis twice daily, or mersenicum 200 every 30 minutes if she thought he was having a heart attack or had angina or chest pain, followed by for months daily. He got that. Arnica montana 200 every 30 minutes, alternating with or mersenicum in a cardiac emergency. And guess what happened to her dad? He outlived all his doctors. He died past the age of 90. All his doctors, all his cardiologists dropped dead many, many decades before him. So the way homeopathy is working is not by suppressing your symptoms, but by revitalizing your vital force. And when you get a fever, your body is trying to do something very good for you. So what homeopathy essentially is doing is giving you remedies that exacerbate that fever. If you get pounding in your heart, you take a homeopathy remedy that causes pounding in your heart. If your arms or hands feel weak, you take a simillimum that in its gross form causes your hands and arms and legs to be weak, and the effect of that is healing. And that is the power of the simillimum. And the theory behind that is when you subject a person or expose a person to a very tiny amount of the amount, it's called constant, sort of like vaccines, but without the dangerous side effects. Their immune system gets revved up and attacks that problem by itself and vigorously. So that's Joette's heart remedy for her dad. And so there's another very important disadvantage of suppressive medicines like Tylenol, aspirin, steroids, antibiotics, chemo, radiation, vaccines, and that is they destroy your gut microbiota. Your gut biome consists of trillions and trillions and trillions. Could everyone who is eating ferments every day raise their hands, please? Everyone who's eating ferments every day, if you could raise your hands, that would be great. Awesome. Your gut biota comprises of the bulk of your immune system. They send out messenger RNA to your cells, to your very genetic structure, genetic makeup, and help you make proteins that your genes are not coded to make. They send you ways, they make vitamins for you, they make short chain fatty acids for you, they release important minerals and fat soluble vitamins into your body constantly. And the medications, on the other hand, are hepatotoxic, so they're cycled through your liver, so they're very toxic to your liver. Chemo is very toxic to your liver. They have cardiotoxicity, so chemo can kill your heart, which is what a lot of people die from. They can cause intestinal bleeding. They can cause depression, psychosis. And part of the reason is depression and psychosis is caused because your gut biota are wiped out, and your gut biota make what? Your neurotransmitters. They cause immunosuppression, kidney damage, renal failure. Statins cause liver failure, renal failure, heart failure. So there's a lot to be said for working with nature and understanding the real life side effects of some of the emergency medicines you're going to take or being asked to take. With homeopathy, you have curing, long-term healing versus short-term symptom relief. So if you do nothing, folks, toss out your supplements and eat ferments instead. If you do nothing else, toss out your aspirin and replace it with Arnica 6X. I would ask. Why should you use homeopathy? And at this, feel free to comment as well, because that would be very useful. The first reason is it's very, very safe. It's not going to kill you. It's not going to harm you. It does not have side effects. You know, even little children can be given homeopathic remedies without problems. Little children would be very harmed by paracetamols and Tylenols and steroids. It is very effective. If you find the right simillimum, it is extremely effective. And the way it acts is very gently. You almost don't realize that you're healing, but you suddenly realize, holy cow, my joints are no longer hurting. Or I had diarrhea for a long, long time, and now that's disappeared. Or I had itching, and it just slowly disappears. Or I had terrible migraines, and over the last 3 or 4 months, they went from 1 a day to 1 a week to 1 a month, and now they're not so bad. That is the life-changing effect of these remedies. So they're very effective.
A very brief question, but maybe entails more response. It has to do with how many of the petite little pilules you use, either in a liquid form, or if you use 2, but then if you use 4, or if you use 6, or use 1, is there a difference in the potency or the clarification that your body would respond to?
Good question, and very, very timely. People think that more pills means a more potent dose. Nope, not true. In homeopathy, 1 pill, 10 pills, 1 drop of the tincture, 10 drops of the tincture, when taken at that particular time, is 1 dose. So if you have those little sugar pills, there's 700, 800 of those in the little bottles, it'll literally last you a lifetime. You can put the little pill in water, sakasip, so you take that thing, pour water in it, and go bang, 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 5 times on your hand, and that is a dose. You can theoretically distribute that dose to the whole world because it has already crossed Avogadro's number. And for the longest time, there were skeptics. There's skeptics who said, how the hell could that be? How on earth could you cross Avogadro's number and still have this thing work? But it works. It works on my bruises. It works on my dogs to reduce their tumor size. It worked on Richard to reduce his terrible grief-induced depression when his dad passed away. And they're finding out that there's nanoparticles in this, in chromatograph, they're finding there's traces of the dynamism of that compound that somehow work, but we don't quite know. But we do know that the similimum is what works, and it works without side effects because the dosage is so very diluted. But 1 pill is 1 dose, 10 pills is 1 dose taken at the same time. And so unlike antibiotics, where if you take 10, that's a huge dose, in homeopathy, that's not the case. It is the number of times during the day that you take the dose that determines potency. So I'm just giving a hypothetical example. You take a 200 potency pill, say twice or 4 times a day. If you are taking a 30 potency, you could take that several more times a day for it to be having the same effect. If you're doing a 6 or 7x potency pill, you could take it several times a day to have somewhat similar effect. Another very important thing to note is for acutes, you can use higher potencies. But for long, slow, chronic illnesses that came to you over 5, 10, 15, 20 years, such as heart disease, you take low potencies. And you take them for a longer period of time to root them out. That's the general principles.
Thank you.
And so it's very, very different than allopathic treatments. More is not better. More is the same as 1. It's very affordable. Of course, you can make a water dose out of 1 pill and conceivably take it for the next 2 months. Anyone can afford it. But more important than anything else, I have experienced this in the last couple of years with people in our care that were in hospice or hospitals. You have this loss of sense of control where you're seeing your loved one being tortured, they're getting morphine, they're getting chemo, they're getting radiation, and you're helpless. And the system demands that you do what they want you to do. You have no control. Here with homeopathy, you have control, complete control over your fate, the fate of your family, the fate of your neighbors, your loved ones, and that is amazing and awesome. Because for most things, if you nip it in the bud in the early going, so let me give you a more current example. You get bitten by a dog, there's a wound here, and there's puncture marks. And you go to the doctor. The doctor is going to prescribe you massive antibiotics. They're going to prescribe tetanus. Tetanus causes vaccine-related illness down the road. The antibiotics wipe out your gut. So one dog bite is going to make you sick for 2 years. With homeopathy, if it is and we'll talk about the exact remedies, but if it's just a puncture wound, you take ledum. If it's a cut and a puncture or a laceration, you take hypericum, you take Staphylococcus aureus. You cover that up with something called a mother tincture of calendula or hypericum. And in the First World War, they compared wound healing with calendula hypericum compared to antibiotics, and it was much faster with much fewer complications than the use of penicillin, sulfa drugs, etc. So the differences were remarkable. And on the next one, maybe we'll go through some of the research that was done by homeopaths of World War I and World War II. Homeopathy has no side effects, very few side effects. I mean, you could prove the remedy, but you'd have to take huge amounts and for a very long time. And the main thing is it works. The underlying assumption in homeopathy is your body knows what it's doing. So it works with your body's responses and not outside of your body's responses. So if your body wants to swell here, you're administering a drug, a remedy that actually causes it to swell. And by doing that, you're curing the condition. And that sameness is called a simillimum. That's like the vaccine simillimum. Only in homeopathy, there is not the risk of aluminum, of fetal DNA, of contamination, of polysorbate 80, of nasty bits of other viruses being injected in a way that bypasses your immune system. So it works with your body. Questions? Hi, Norel.
Hi, excuse me, everyone, being late.
Not a problem. Okay, so I thought nothing is better than examples. So this is a person, you may have heard that silica takes out splinters. And this is actually a case in that link below, and I'll send you the PowerPoint. You can look at that link. Silica taken for 24 hours, small doses, 6x doses, pulls that splinter out. So can everyone see my arrow? Just wave your hand if you can see my arrow. Okay, so this is the point at which there's this splinter underneath this person's nail, and she couldn't reach it with tweezers. This person couldn't reach them with tweezers or a sharp object. It would have involved cutting the nail open, and you know how torturous that is. This was day 1. This was, I think, day 3, when the splinter is still visible here. And that's when she started taking silica 6x. And within 24 hours, this is what happens. You see this? No more splinter. And what silica is doing is it's causing your body to suppurate the foreign object out. So there's a lesson here. If you have a foreign object in your body, a pencil lead in your hand or a thorn, and you can't get to it with a needle, use silica within 24. And for children who howl with pain if mom uses pins, you can use silica to get the splinter out. It's magical and it's miraculous.
Sushma, a brief question about that. How exactly does the splinter, is it absorbed by the body or is it expelled from the body? What happens?
It's expelled. It's expelled by the body. So what's happening at the site of infection with the silica is it causes suppuration and the skin tissue to sort of liquefy. When it liquefies, it pushes it out with pressure. And so from behind it, it's like hammering it from the pointy end. It gets it out.
A kind of continuation question. I had a splinter a couple of years ago. I couldn't get to it, didn't know about this guidance. I went to the doctor, they couldn't get it out. And they said, don't worry about it. Your body will absorb it if we can't get it out. Is that true?
Nope. I have a splinter from a pencil lead that's still sitting. You see this? That's a splinter from a pencil lead that's still sitting there. It might absorb animal tissue, it might absorb certain things, but it's definitely not going to absorb a piece of wood or carbon or the lead from a pencil or a piece of nail or bullets or shrapnel, etc. But you just raised an important point. Be careful when you take silica. If you have a bullet lodged in your brain, bad things can happen when you eat silica. So use it with judiciousness is what I would say. If you have tumors in your body that are hardened and encysted and they're close to the skin, you can take silica to spit them out. But if they're deep within your body, be careful. First shrink them and then take them out.
Would that apply to me, Sushma?
I say what?
Would that apply to me as well?
If you were to take silica and you had things in the breath, in the chest, you know, the scar tissue,
Yeah.
it's gonna try and evict it out of your body. So I would not recommend silica for you, darling.
All right.
Okay, nail infections. One of you asked a week ago about nail infections. You see that? Everyone following the arrow of mine? Do you see that green suppuration there?
Mm-hmm.
That's an infected nail. You get it when you wash your hands a lot in hot water. Bakers get it, cooks get it. People, laundry, washer, if you wash your clothes a lot, you get it. If you're in the water, sometimes you get it. And for that, a very good remedy is Buforena. Buforena is good for infection of the nails, whitlows, which is essentially things on your palms, your hands that get or under your nails, near your nails that get infected, pustules, suppuration from injuries, bully, which is like boils which open and leave a raw surface, or which exude fluids, blisters on the palms and soles of your hands, itching and burning, carbuncles. You get hoof, a lot of kids today are getting mouth, foot, and hoof disease. So a lot of these kids, this is a great remedy. But this is also very good for nail infections. If you're working as a chef, a lot of people are constantly have their hands in water. Great remedy. And the dosages, you keep using it. So for the 200C, you would use it 2-3 times in one day on day one. And then as it gets better, you taper off. Maybe once a day or something for a few days. And so this is a way to not use antibiotics. You still have your gut bacteria, you still have your microbiota intact, and your body just cured itself. Homeopathic medicine, you've all used it for arnica. I had a bruise that looked like this, only much worse. When the cart fell on me, this was the wheelbarrow, filled with dirt, fell on my leg. And it was, I cannot describe the magic of, it was Arnica 30X, I think, Arnica 30X. I hobbled over to the kitchen drawer, took it, and it was as if a tingle went through my body. I was lying on the grass in pain, and it went away. So anything that's a bruise, meaning you see how this is not broken, that's arnica. You see how this is not broken, that's arnica. Anytime you get an injury, a bruise, a contusion, black and blue marks, that is arnica. Please do not use arnica if you have lacerations like this. There's a different remedy for this, and that is hypericum or calendula for open wounds. So be very careful. If you have an eye injury, if someone hits your eye like that, aconitum is the arnica of the eye, and it's very, very helpful. The pain goes away almost instantaneously, and frequently when you don't do that, the effects of that concussion or that contusion last for years and years. And so if you have a concussion like this, if you have a concussion sort of like this, always take natrum sulfuricum to take away the bad side effects, mental side effects of a contusion or a concussion. or the brain swelling, or the meningeal swelling. Years later, the homeopaths have found that taking that, so you fell down a ski slope, you hurt yourself badly, you whacked your head, and you're okay, but you're never the same afterwards. If that's the case, take a few doses of nat salt and you will feel the difference.
Question.
Yeah.
If you have a combination of a bruise and broken skin, what should you use as a guidance for what to take?
For broken, so take measure. If the skin is more broken than bruised, go with hypericum and calendula. And if it's hurting a lot, first and foremost, take arnica. If you're in shock, take aconitum. So aconitum for shock, arnica if it's hurting badly and it's bruised, but debate it with yourself. If, for instance, this person has a lot of lacerations, arnica is going to cause him to bleed because it actually is like an aspirin. It's going to thin your blood a little bit. So you want to eat calendula, you want to eat hypericum, and you want to eat an aconitum. But in this case, if that's all the bleeding there is, and if he's got a lot more black and blue, then arnica might be the solution. But that's a good question. You'd have to make a judgment call. If you're in too dire of a pain, then take the arnica by all means, but you might bleed a little bit more. If there's internal bleeding, that is something you really need to go to an emergency room for, because you don't know where you're bleeding. They may need to open you up. This is for when you know what's going on, you can take a lot of actions at home. If you have tendon, if you hurt your wrist, you have writer's wrist, that's damage to your tendons, that's ruta. You can take it all the way from 6C for chronically deranged wrists, all the way to 200C for sudden injuries to your back, to your joints, especially your wrists and tendinous areas. If you have bone injuries, like if you whack your skull, then symphytum is great along with aconitum for eyeball, eye socket injuries, where your bone periosteum is bruised. Like this person could use symphytum and aconitum right off the bat. This, the injured person here. So we talked about arnica for contusions and blunt trauma, ruta for tendon injuries, wrist injuries, writer's tendinitis, symphytum for bone and periosteum, aconitum if you have shock, if you hear bad news, if you have shock, take an aconitum, carry it in your purse or your bag or your pocket. It will prevent that heart attack or stroke from shock, or watching an accident or seeing something terrible. Take an aconitum, you'll feel better.
Question. If I have an injury from some years ago and it's still creating soreness or pain to mitigate it, but less, what should be the guidance for how much to use and how often?
I would, for old injuries, use Bellis perennis.
Okay.
And I will get to that in the next couple of slides.
Great, thank you.
Any other questions in this?
Well, depending on the news, it looks like we should be taking aconitum constantly right now.
Yes.
It's inducing, it is mind-boggling.
Yes, actually it is true. When Richard and Jim got news of their dad's passing, they were here. I gave them the highest, I think it was an aconitum 1 mil or 200,000 or one, I forget. Within minutes of taking the aconitum, both of them went to their respective rooms and just fell asleep.
How
and
many
they woke up
pellets?
refreshed. Yeah.
How many pellets? Sorry, Danny.
What's that?
How many pellets did they take? How many little?
Oh, just one. I just gave them one dose. One dose. They were knocked out and they woke up refreshed. One of the signs of a remedy working is the patient goes to sleep. They're not agitated. They're less anxious. They sleep. Children sleep. And so it was pretty cool to watch. Of course, and these are people that don't sleep. They have a problem with sleeping.
Thank you.
All right, cuts. So we have to make the distinction between small time cuts, which is like the cut over here. You fall down, you bruise yourself, you cut yourself, and it's like a big bruise or a small cut. For that, you apply calendula tincture externally. It looks like something that comes out of a bottle, and it's in alcohol or water. The tinctures are either in alcohol or distilled water. And you apply a few drops here, and that's it. And if you were to do a side-by-side comparison, try this. If you get wounded on 2 knees, try calendula on 1 knee and try, antibiotics or Bactrim or iodine on the other, and see which one recovers faster. I guarantee you that the one with calendula will recover faster. And it's not an antibiotic. Calendula is not an antibiotic. It's weird, but it works. If someone had a question?
Do you apply it to the actual wound itself?
Yes.
Okay.
You apply it to the actual wound, or if it's bleeding profusely, you've got a damn bandage on it, cloth bandage, you just pour drops of calendula on it, and it'll keep seeping through into it, and it'll heal very, very fast. If from that wound you see a line, a red line going up, or you have pains shooting up 1/2 foot above that wound, that means the infection has traveled upwards. It's traveled along your nerves. At that time, you also apply hypericum tincture and take hypericum internally. That's critical. Hypericum 200 internally, and I should have written that down, but note that. I'll change it in the PowerPoint. So small cuts, you put calendula on top. If the cut is infectious, you put calendula and or hypericum, depending on what it's like, and you take hypericum internally. If it's a puncture wound, you take Ledum 200 right away, depending on the intensity of the puncture wound. If it's a big nail that's gone, 1 inch deep, then you want to take Ledum as frequently as every 1/2 hour to hour for 2 days, a dose of 200 C. It'll clean up good. It's almost like an anti-infective. You will not get tetanus. You will not get infections. In fact, it will heal much better than it would had you used anything else.
Brief question.
Mm-hmm.
If you go back a few steps, the difference between using hypericum and calendula is a tincture. I'm not quite clear on when you use which.
Okay, if it's a bruise and a cut, which is open, you use calendula tincture. If so right at the very first moment that you hurt yourself, use calendula. But if 2 days later, you find that the infection has spread, there's a big red welt around the infection, apply hypericum to the wound and take hypericum and calendula internally.
Thank you.
There are certain wounds where you're almost guaranteed nerve pain, back injuries and so on. And there you do want to take hypericum internally. It'll just save you on injuries later. If you're going for voluntary surgery, which is where you have, a clean incision where it's breaking through 7 layers of your skin, which is clipped together like so, you want to take Ledum and Staphylococcus aureus alternating 200 C a little bit before the surgery and well after the surgery. And you don't need antibiotics, you don't need nothing, wounds will heal just fine. And so learn to smuggle things into your hospital, or don't have to smuggle, just declare that you need to have these remedies with you if you were to go in for elective surgery, hip surgeries, appendicitis surgeries, and so on. Have Ledum Staphylococcus aureus on hand, 200, and dose them, and take ARNICA with you in surgery, and you will avoid morphine, OxyContin, Demerol, Tylenols, ibuprofen. You'll be able to endure immense pain with all these remedies. Just carry a kit with you.
Another
What do
question.
I mean by, yes, question?
The difference between a tincture with alcohol and water, is one superior to the other, or just the options?
No, not one superior to the other. There are some compounds that don't dissolve in alcohol and some that don't dissolve in water. And so they're just using whatever they can to create the tincture. So you can use either. So everyone know what a laceration is and how it's different than a surgical wound or a cut. This is a laceration. This is when, you know, someone got dragged on a road, they were on a motorcycle, their face got dragged and they got bruises everywhere. That's a laceration. So this person, I would give them symphytum and aconitum for that beautiful black eye. I would give them calendula tincture on those bruises, and I would give them hypericum internally, because with a laceration, there's a lot of nerve injury. See how when the wounds are diffuse, all the skin nerves, which are very sensitive, are gonna be affected and they're gonna hurt like hell. So for lacerations, I would recommend putting down calendula, hypericum internally, or even hypericum on top of the wound. And then for the black eye, I would do symphytum and aconitum. And ruta as well. Ruta is great for the eyes if there's tendon damage.
Sushma, I have a quick question. So for the tinctures, can you make them from like the hypericum pellets,
Sure,
or is it
Sure,
different?
What you do is you take the elixir, whether it's an alcohol tincture or a water-based tincture, you take 1 drop of it, succuss it. So you can make your own homeopathic remedies by succussing. So you bang it 40 times, toss it all out, keep 1 drop, fill the bottle again, bang it 40 times, and if you do it 10 times, you have a 10x tincture of that solution.
Okay, so you can't just like put like a pellet of the hypericum into water and use that as a tincture. You need to potentize it.
Well, so the reason I say no to pellet is the pellet is made of sugar, and you don't want sugar on your wound. The tincture does not contain it's alcohol or water, and so it's safer. You know, sugar will just feed bacteria.
Okay.
But the in and of itself, you know, it wouldn't hurt, except that it's an open wound and you don't want sugar in it. And so I would recommend everybody get, even if it's a tiny, tiny bottle of hypericum tincture and calendula tincture, just mother tincture, just keep it on hand, you know, it'll last forever. It'll last for 50 years, especially alcohol tinctures or tinctures made in distilled water. And it'll have a vastly better effect on your injuries than anything else you might use, and no side effects. Alrighty, burns. So everyone know what 1st degree, 2nd degree, 3rd degree burns are? Raise your hands if you do, or raise, okay, you do, okay. So 1st degree burns are very minor burns, which is what you get when you put your hand in the oven for no more than 5 seconds. This guy here probably has an oven burn. This is like a 2nd degree burn. And when you are in a forest fire in a house and you're burned to the bone, that's a 3rd degree burn. And there's different medications, different remedies for different types of burns. And I have not experienced it myself, but I have heard people who say the pain, within 3 to 4 minutes, the pain disappears. It is that miraculous. Applying cold water on these blisters, and this is going to harm more than hurt. When your body is burning, you want to apply things on it that also burn. And that is what Urtica urens is. It's the stinging nettle remedy. It's the stinging nettle homeopathic remedy for 1st degree burns. You apply it, you take it internally. You can also keep a tincture and you can apply the tincture. But you can simply apply a calendula tincture and take Urtica urens, and the burn will disappear in a very, very short time. That's for 1st degree burns. If you have pretty bad burn, and you be the judge of how bad the burn is, and you're looking at blister formation, Cantharis 200C is your friend. At the onset, you got burning pains, it'll prevent blisters, and it'll prevent 2nd degree burns. which frequently leave bad scar marks. So Cantharis 200 is fabulous. If you got burnt, if you already got burnt, you know, many, many months ago, and your burns are slow to heal, and they're still raw, and they are sore, and they hurt, and they're old burns, then causticum at a very low dose is great. You know, causticum in 30C, 6X, 12C, something like that. Actually, the X potency is probably better to slowly, gently heal old burns that don't heal properly, where you have pain underneath the connective tissue as well. And hypericum is very, very good in all these cases because you have nerve pain. Your skin's burning, the nerves under your skin are just sensitive. So hypericum will prevent infections and it'll bring you immediate relief. What you don't want to do is hold it under ice water because you're gonna guaranteed to have blisters and scars. Apply calendula topically, and if they start to become infected, if you have burns with blisters that start to suppurate, Hepar sulf is great. It's like green, yellow discharges. Hepar sulf in small quantities, lower dilutions to help them to flow out, and in larger potencies to abort a suppuration. So if you find a suppuration just starting, then take a very high dose of Hepar sulf. You follow me? If it's about to start, to prevent that suppuration, you take a high dose of Hepar sulf. But if you already have a suppuration, if it's already infected, you take a small, low dose to cause it to flow out of your wound and suppurate.
Sushma,
Yes.
I have a neighbor who has wounds. They're not burns, but they're wounds, and they're starting to be infected.
Mm-hmm.
Would the Hepar sulf also help get some of the infection?
Yes,
Bring it up.
yes. It also depends on where it is. If it is anything on the palms, near the fingernail, huh?
On the legs.
On the legs, Hepar sulf will work great.
Right.
Are they suppurating, or are they just starting to get infected?
They're infected.
Okay.
And yeah, I haven't
Okay.
seen them, but
Okay, so Hepar sulf 200, you know, a couple of times a day, even more times a day if they're seriously infected, will really help. Alrighty, for folks who have boils and carbuncles, what are they? Boil is one thing, one little boil. You know, it's an infection. It could be an infection in your sweat glands, you know, where the hair goes in at the base, there's a sweat gland that gets infected. It could be an infection from an insect bite. It could be, you know, just a boil with pus formed in it. They're wonderful, wonderful remedies for that. And the chief remedy for boils and carbuncles is something called Tarantula cubensis, 6C. Small potency, it'll just kick the boils and carbuncles are these clusters. Even clusters of boils form around a central boil. That whole thing, that whole grotto is called a carbuncle. You could have carbuncles, you could have boils, you could have blisters, and for these, Tarantula cubensis is great. If you were to buy one remedy, I would say get that. Silica 6X, again, you can use it to eject long-term growths. You know, like you've got sebaceous growths on your skin that have been there for 20 years. Silica 6X is your friend. But remember, if you have these growths on your hand, and if you also have a metal plate and a bone from a fracture, that's gonna try and come undone as well. So be careful with the use of silica, please. Make sure you don't have other things in your body that you don't want to come out. If you have implants in your body, avoid silica, dental implants. It will release them. Hepar sulf you use in a very low dose, like 2X, 3X, to suppurate a wound. So if it's got pus, you want it to get released, you just use low doses of Hepar sulf to suppurate it out and heal. And if it is just starting, then you use a high dose of Hepar sulf, and it'll abort the whole suppuration. But
I'm sorry. If one has carbuncles, I have a friend who had some carbuncles on their legs, still does. Is that a deficiency, a vitamin deficiency?
It is a general deficiency of nutrients, yes. Vitamin A, vitamin C. So if they ate liver, that'd be wonderful. If they ate, fresh greens, which contain a lot of vitamin C, that would be wonderful. Yeah, and skin is a mirror to the rest of your body. If you have problems in your skin, there's something going on inside your body that you need to take care of. And that's the pot of soup. The gelatinous soups are wonderful for the skin.
Another question. It has to do with sourcing the homeopathics. I've gone to Washington Homeopathics, and on a lot of their preparations, they go to 8x. They do not go down to, they do not get 6x. I'm wondering if that's a source difference from a different homeopathic place, or what your guidance might be.
Try in different homeopathic places. If you don't find them, or Washington Homeopathy has it going from 2x almost all the way up. Call them because they run out of stock. And when they have it, they will send it to you. Or ABC Homeopathy always has stuff in stock. Hard to find
Thank
stuff.
you.
It's in Canada, I believe, ABC Homeopathy. So there's a shipping charge, but if you need something for cancer, you need something for cancer. Don't hesitate. Alrighty, nosebleeds. A lot of people have nosebleeds. What we have at the tip of our nose is 2 systems of arteries foregathering here. And so this here, the tip of your nose, is a very rich bed of arteries. And if you are ever in a hot tub, or if you get overheated, or if you are baking with an oven open and closed all day long, or if you're a chef with steam coming out of pots and pans going into your nose, you frequently bleed. And when you bleed a lot, there are wonderful remedies in homeopathy that you can take to prevent bleeding and to prevent the current bleeding and to prevent the condition of bleeding ongoing. And I'm going to name 4. If you had to buy just one, Vipera 12C is great for any kind of bleeding from your nose. It typically is bleeding with vertigo. You stand up, you're in a hot tub, the water is this happens to Richard a lot. The water is very hot, he starts to bleed, he gets up, he has vertigo, Vipera 12C will knock it out. If it is summer heat, induced by summer heat, sitting on top of hot stoves, Glonoinum 30C will curtail it and prevent future nosebleeds. If it is dark blood, not bright red, if it is dark venous blood, which is coming from the back of your nose, and if you have piles maybe, then Homeopathy 30C is your remedy. And if you have dark clots coming out of your nose by way of blood, then Lachesis 30C.
So Shema, I have another question. I follow your guidance about minor, major, and extreme cases. When you say 12C, what would be the difference in using, say, a 12C versus a 30C?
Not much at all. But a lower potency will work just fine. That's what I'm trying to say. And there are some things for which a lower potency is desired, and some things for which a lower potency is all you need. So always start with the lowest potencies and then go to the higher potencies if you actually need them. 30C is just fine too. If you don't have a Vipera 12, means use a 30C. Glonoinum is also wonderful for sunstroke. How many people have gone into these 4th of July parades, you're overheated, the next thing you know, there are people around you and you're lying down on the ground. Carry Glonoinum with you. If it's a hot day and you're feeling overheated, before you fall faint and fall and faint, take a Glonoinum and it'll prevent heat strokes. Or if you have nothing else, a belladonna will do too. What's happening in the heat stroke is your head is becoming encephalopathic. Your brain is swelling from the heat, and Glonoinum will stop it in its tracks and make you will normalize and stabilize you. Homeopathy, if you've got, so the reason I'm giving you bunch of remedies. I could have just said one remedy, but people have different circumstances. Some people have bright red blood, typically. Some people get it only in the summer heat, typically. Some people get it only in the tub, and some people get black clots out of their. So these are the remedies for those. Alrighty. Insect bites, dog bites, swelling. Anyone here have anaphylactic shock from anything? Raise your hand. Has anyone ever had anaphylactic shock from bee stings?
Tom has.
Okay. Anyone with that kind of situation needs to hang on to Apis 1M. It is exactly the same effect as having an EpiPen, as having a norepinephrine injections and shots. Works in seconds to minutes for your swelling. So you got bitten by a bee, it swelled up like this lip here, and the next thing you know, your throat is closing. Take Apis 1M, 1M, 10M, whatever you got, in doses of every 2 to 5 minutes, as much as every 30 seconds, if you need to.
Does that apply for nut allergies? I've got a grandson who has to go with an EpiPen every day.
Absolutely. If he swells up, if his membranes swell up, if his throat closes, Apis 1M is 100 times better in terms of side effects than some of these other steroids and drugs.
Okay, thank you.
And what it does is, over time, it is going to cure that allergy. And that is the beauty of homeopathy. It is not suppressing your symptoms. Apis is actually something that causes the swelling to occur. By encouraging this, the body is actually healing itself. So it's encouraging your vital force to reduce its exacerbated reaction to these sorts of things. For children who are vaccine damaged, I've seen stunning results. Their brain swelled up, or at the site of the injection, the arm's gone to twice that size. Apis 1M is miraculous.
Well, that could have worked for radiation too that I got on the brain.
Yes, absolutely. Radiation swelling, nothing like Apis.
Would it still apply now, though I had it last year?
If you have swelling, it would still apply, and yes.
I wouldn't know though.
You would, yeah, it should, right after the surgery, it would have helped greatly.
Yeah.
Yes. For any puncture wounds, Leadum 200 right away. Hi Claudia. Leadum 200 right away, 2 days, 4 doses a day, 3 to 4 doses a day. If you have nerve pain infections, and you can tell them by the fact that you see this long line going from the infection or the bite site all the way up your leg, all the way up your arm or around your belly, that is Hypericum 200C. If you have shingles pain, Hypericum 200C is miraculous and magical, along with racemosis bulbus racemosis. There's another remedy for shingles that's awesome. Calendula tincture on any lacerations from dog bites, animal bites, open wounds, and Hypericum tincture if there's nerve pains, and internally do take calendula and Hypericum as well. So that's insect bites and dust. So the key is not to freak out. Now you know exactly what to do. Stay calm, don't freak out, don't run to call 911. Every time a ambulance comes for you, it's like 20, 30,000 bucks. You're gonna be in hospital for a day. They're gonna put you on steroids and all sorts of terrible things, and you catch hospital infections. Not a good idea. This will cure you in minutes to seconds. You can go back to your business, you'll save a day, you can get back to gardening and be well-er afterwards. Okay, this is where we answer Lance's question about old injuries. There are some injuries where Arnica montana applied, or aconitum and arnica applied long after the shock is over, help greatly. But if you have an old untreated injury, such as, you got your fingers slammed in a drawer. A friend of mine had her fingers slammed in the drawers several, you know how you do it once and you keep doing it. You just keep doing it. Well, my grandson was, when he was starting to crawl, he would get his fingers slammed in the drawer. You give arnica right away. But if you don't, and if after 1 year you have big nodules here from that injury, you take Bellis perennis for old, untreated injuries, things you never got sorted out. So you hurt yourself, you go to a masseuse, you get all sorts of therapy, nothing helps. It hurts and hurts and hurts, and a year later it's still hurting. You take a large dose of Bellis perennis, like 50 m or 50 lm or 10 m, it will do wonders. And I have that, so if anyone has back injuries, I'll bring you a dose so you don't have to go buying it. I'll send it over with someone whenever I drive back and forth. So Land, if you need Bellis perennis, I can send you a water dose.
The injuries that I'm referring to for myself have to do with a bone injury, damage to a bone on my knee, actually.
Okay.
So I don't think I don't think it's the same.
Yes, yes. For old bone and knee injuries, it would be periosteum. So symphytum and hypericum, I would say. Do the Banerjee protocol, 200 symphytum, 200 hypericum in water, you know, take it a couple times a day, 2-3 times a day. And if you have present pain, as in walking pain, take an arnica. If you walk into if the pain disappears and you walk, you will heal. Because frequently, once you have pain, you walk funny and then everything hurts. This is something, I didn't know whether to put this slide in or not, but this is about death. I have experienced the hospice care industry closely in the last, it's sad to say, but closely, and the ICU industry as well. And what I find in hospice is basically they send a bed home, you know, like a hospital type bed home. And then there's a lot of morphine and OxyContin, fentanyl type products given to a person until they die. And guys, death is a beautiful experience, just as life is a beautiful experience, just as birth is a beautiful experience. And what you don't want to do is die like this. This is how a very close relative of ours recently died in a COVID ward in a hallway, not surrounded by family. And that's not how you want to spend the last moments of your life. You want to die like this. You want to be in your right senses. You want to have your pain taken away without being in this stupor, without having constipation, without having muscle failure, and while still being alert to the, you know, the people and the souls that you care about. And for the end stage of life, Arsenicum album is wonderful. It's the remedy that helps you cope. There's this intense anxiety right before you die. And there's nothing more powerful than Arsenicum album 200 to deal with it and help you, you know, be with the people you love, be with God, the spirit, or whatever it is, and go in peaceful transition. And I wish I had been able to give this to the people around me who passed, because I will forever regret the fact that we had no other option than to put them into a stupor or hook them up to machines where they were vegetables.
But Sushma, I hear you. I've helped 2 people die, 2 close friends of mine, and I was mortified by this morphine thing. Anyway, I'm allergic to it. But the thing is, what about if the pain is too much?
There are fabulous homeopathic remedies. There's arnica, there's hypericum, and there's all sorts of pains, and these work beautifully. They have worked in delivery pains, labor pains, post-surgical pains, burn pains, you know, bruise pains. There's no reason why they would not work in cancer pain or, you know, chronic degenerative disease pain. And they can do this while still giving you the wherewithal to just be there, to be present.
Well, that explains why Big Pharma is going all out now with vaccines and everything, because it's an all-out war. It's not even covert, it's overt now.
Yeah, yeah. This here on the right cost someone a couple of $1 million. It decreased the patient's quality of life greatly, and it did not allow for that peaceful transition into the next world. You want to be like this. I want to be surrounded by my children, by my grandchildren, by my dogs, by people I love and care about. And I want to do it in a way that allows me to experience that without hardship. And it's possible. It's possible. Very cheaply possible.
Can I ask you a question?
Please.
Give me your feel on this COVID, because my doctor friends, physician friends are telling me it's not what we're hearing on the television from New York, from other parts of the country and here. Could you please tell me exactly? And this morning on a walk, I met a cardiologist and a brain surgeon. One was 80, one was 75, who both said nothing exists in the sunlight.
Yes.
And don't wear masks. So we were laughing, my girlfriend and I, saying, thank God someone's not wearing a mask around here. What is it exactly, this COVID?
Let me explain that with a number. In New York City, the death rate of COVID is about 1,300 people per million.
Are we talking 1,400 with heart cancer, which they call?
Most of them had comorbid conditions. And in California, that number is 100. Do you see the difference? It is like 13 times greater in New York than in California. We have sunshine, we have fresh air. We did not mercifully know about this raging virulent infection all the way from October, November, December, January, February. So it spread through the population, unbeknownst to most people. Most people did not even know they had it. There are some people that got affected and some people continue to be affected, but there are people who are typically very, very elderly or have severe comorbid conditions. And so in many ways, we've shut the world down for the sake of...
It's political.
It's for less than the flu mortality, less than the annual flu mortality. And the cost, the death rate from the non-COVID deaths is going to be astronomical. To give you an example, in India, a population of 1.3 million, 800 million people live in poverty. We have a lockdown, no one can work. And we're putting 800 million people into malnutrition, suicide, murder, death, malnutrition, starvation.
It's a eugenics program in full force in front of us.
Very sad, very, very sad.
Yeah.
And so the key here is to embrace our bacteria, our viruses. Please don't wear masks when you're outdoors. You need the sunshine and the fresh air. With a mask, you become hypercapnic, which means you are drinking your own carbon dioxide and your stomach pH, your blood pH level goes up. You become acidotic, and that is terrible for your health. The other thing is I'm working with people who are large families in particular, who you have a number of people cooped up at home together, sweating, getting anxious together, and all sorts of infections start brewing when that happens. You want to be outdoors, you want to enjoy the sun, you want to make a pot of soup, you want to eat good foods, and I guarantee you will not get COVID or die from COVID. You might get it, but you will not die from it. All right, all this is to say that you need to have your remedies on hand before these emergencies occur. So it's very, very important to be prepared. Check your family's needs. So what I simply do is this. I'll go person by person. Richard, what does he need? He bashes his finger with hammers. You know, he gets stung by bees. So these are the 5 things. And he has nosebleeds. So I have all of Richard's remedies in various potencies on hand. I have mine. I stubbed my toe and broke my toe. So I have all the broken bone remedies. I have them for my grandson who visits me for extended periods will visit me for extended periods of time and will hurt himself, get sick, and so on. So what you don't want to do is go looking for a remedy at midnight after you have broken your finger. So get them in advance. Don't wait until there's an emergency. That red kit there is 100 remedies for about 220 bucks or there. That works out to $2 a remedy. And that is 200 power remedies for 200 bucks. Helios has some remedy kits, or you can get them separate, however you want, but keep them on hand. They're an insurance, and they're not an insurance just against this disease. They're an insurance against iatrogenic illness, meaning hospital and medical induced illness that may cost you your life, and that costs hundreds of millions of dollars and does a great deal of damage. So think of this as, you know, $1,000 of cheap insurance or $100 of cheap insurance if you're just doing it for yourself. And here's a list of all the remedies I've used, and I'll send this PowerPoint out to everyone. Oh, who is it that I don't have email addresses of? Joseph, I have your email address, I believe. iPhone 269, I don't know if I have your email address or not, but you'll tell me and I'll send you the PowerPoint. And I'm gonna stop recording, pause, stop, and stop sharing. And then, hi, we can all talk. You can unmute yourself.
Sushma, will you go back one slide? Never mind. I guess you're going to send it to us, right?
Well, did you have a question?
I just wanted to look at the remedies that you had, and that was actually one of my questions. Do you have, I know you said you have specific remedies for each person in your household, but do you have like, you know, like a basic kit for just emergencies in general, and what would be in that? That was one of my questions. And the other one was like storage. How do you store the remedies?
Okay, let me pull that right up. Okay, so these are the remedies that I discussed today. Wait a minute. So that's 1, 2, 3, 4, 5, 4 is the 20, about 20, 40, 45 remedies. I discussed about 45 remedies. You want to keep them away from heat and light. And I buy these little trays from a dollar store and just put them in alphabetical order and use a drawer in my kitchen, or you can use a separate drawer or a dresser drawer, or you can have a stack of little drawers that you put in another drawer and use that as a storage space. Generally speaking, these are very hardy. You can, you know, people have taken them through baggage checks and the x-ray machines, and they seem to work just fine. And ARNICA is a short test. You take an ARNICA through baggage, you hurt yourself bad, you take the ARNICA, you see what happens, it still works. And so I would say to keep them away from heat and light, and then you should be fine. And I'm gonna stop recording now.